I've been an intensive care nurse for 7 years now. It's never ever been an easy job looking after people on life support. I have grown up in a national health service which has been subject to a decade of austerity. So last night when Boris Johnson, who's fully supported every cutback, every service sell-off, every act to suppress the wages of healthcare workers, stood outside 10 Downing Street and joined in a mass applause for us. Well, it was frankly just hypocrisy. There's a lot of hype about us in the media at the moment, and the truth is that we're not heroes or angels or celebrities that need applause. We are workers who are doing a very difficult job to the best of our ability, just like all of the other workers in supermarkets, on public transport, doing less glamorous jobs like broadband and sewage. You know, we are the working class, and we're the people who have proven ourselves to be indispensable to society. I don't want to be sort of too bar humbug about the mass applause that took place last night, because I tell you, when you go out into your onto your doorstep, into your community, and the whole street is there clapping and cheering with kids and pots and pans, you realise how much power collectively we have, and what we could do if we decided to channel it in the right direction, into a direction to achieve what it is that we need. So what is it that we need at the moment? First of all, we need adequate personal protective equipment for all workers that are coming into close contact with the general public. It is essential not just for the health and safety of individuals, but also to prevent the spread of the coronavirus. Not only have the government failed at a national level to plan and supply adequate PPE to people who are looking after those with known or suspected COVID-19, they've completely overlooked the fact that this is a virus which can be spread by people who have got no symptoms whatsoever. That puts all health and social care workers who sometimes come into contact with hundreds of people every single week into a very vulnerable position. And this has been compounded by the fact that up until about an hour and a half ago, unless you were admitted to hospital because you couldn't breathe, or you are rich, famous and willing to pay, you cannot get a test. If you're Prince Charles, you can get tested. If you're Boris Johnson, you can get tested. If you're a nurse caring for a critically unwell COVID patient, you can now finally, congratulations, get tested. But if you're a porter going from hospital ward to hospital ward, you can't get tested. If you deliver post or stack shelves in Tesco or work in a call centre for a gas and electric company, you can forget about it. And that's not because your body is any more durable to the coronavirus. It is not because you are less likely to infect other people. It's because in a capitalist society, it's one rule for the wealthy, and it is another for the millions of working class people who toil every day to keep the show on the road. The only reason that the government today have caved and said that workers in critical care environments can now get tested is, first of all, because there are trusts in London where half the staff are off sick, but secondly, because they're absolutely terrified of a public backlash when healthcare workers are getting sick and potentially dying of coronavirus, because they saw the popularity and the support that the public hold the NHS in last night. And why is it that testing has been so strictly rationed in the first place, when all of the evidence from the World Health Organization says test, test, test? It's because the NHS, despite the fact that it is the envy of the world in terms of its ability to deliver a publicly funded universal healthcare system, it has been underfunded for decades, while successive governments have pursued programme after programme of privatisation. And this has meant that the system is stretched to burst in normal times. So now, in the midst of a pandemic, NHS labs which test samples are unable to cope with this additional pressure. What this means in practice is that people who may or may not have the coronavirus in hospital are cohorted and nursed alongside people who do. And they wait sometimes 5, 6, 7 days, sometimes longer, for results. So if you didn't have it at the start, there's a very good chance you'll have it at the end of it. And we're starting to see this week now cases of hospital-acquired COVIDs, which is inevitable in a system which is under the kind of pressure that an austerity hit National Health Service is feeling under the impact of this pandemic. We face a very real possibility of widespread infection of staff. Today there was an article about some meetings which took place way back in 2017 when Jeremy Hunt was the Health Secretary, in which it was decided to downgrade the guidelines about the level of PPE that workers should have access to when looking after respiratory viruses, and reduce stockpiling to cut costs. So we were not in a great position to start with, but the problems of getting PPE onto the bodies of the workers who need it have been hugely exacerbated by the fact that there is an internal market which exists within the National Health Service. Local trusts compete with one another for business, but they also procure all of their supplies separately, which in itself is a really mad, inefficient system. But it gets worse because private companies are really keen to sell stuff to the NHS at the moment because they know we need it. And there's a lot of companies at the moment making different FFP3 masks, which are the masks that protect people from inhaling particles of coronavirus. But the fact there's loads of companies producing them doesn't actually make it any easier to get those masks onto the faces of the workers who need it, because each worker has to be fitted and tested on each different company's mask, and you don't know which mask is going to be there from 1 week to the next. You don't know if there is going to be a suitable mask for you, and that is in areas where the PPE has been accessible. PPE has been accessible, by the way, through the sheer determination and hard work of the workers on the ground, not because Matt Hancock has decreed that it would be so, or because the market, a system for producing and distributing goods by private companies to make profit, is a system that works. It's not. It is an absolutely terrible system which is having catastrophic real-life consequences, including loss of life for ordinary, blameless people across the planet. So the question really becomes, what can we do about this? There is an immediate need for PPE and for testing. No overnight injection of funds is going to reverse the decades of underfunding and structural privatisation that has taken place, not just in our NHS, but across all of our sort of interdependent public services. We need an expansion of the National Health Service to include production and distribution of medical supplies, not leaving it to the likes of James Dyson and other Tory mates who want to flog us some gear. Who should make the decisions about what gets made, when and how? That should be under the democratic control of the people who do the work. In a few short weeks, the workers who were low skilled have become essential, and it's been demonstrated in the clearest possible terms who it is we need as a society. You've only got to look at the stock markets to see what happens when workers stop working. It's workers who produce wealth. It's workers who keep society going. It's not landlords or investors or banks. And actually, out of this crisis, it's we as working class people that will need to come up out of it, not just asking for a little bit more money for the NHS or a pay rise here and there, but demanding a society that is driven by the health and well-being of people and our planet, and that puts the power and wealth into the hands of all of us collectively to run in our own interests. This kind of society is a socialist society, is a socialist world that we in Socialist Alternative are striving for. So if you're on the live stream and you're not a member, I urge you to get in touch today. This is a really frightening time, and I think I speak for all workers when I say we are at the start of what is likely to be a very, very rough ride indeed, but it's not forever. And there is a tomorrow. If you want that to be a socialist tomorrow, then I urge you to join us, because we've got a world to win. Thanks.